400%. That's the increase in heroin cases the Brown County District Attorney's Office says it's seen in the last 4 years. For the first time tonight, Target 2 Investigates is getting a look at the numbers showing the thousands of people affected by this highly addictive drug and the lengths they're going to get it. Sarah Thompson joins us live with the latest information on the heroin epidemic in Northeast Wisconsin. Sarah.
Cammie, we've reported on what law enforcement call the heroin crisis for months, but Target 2 has spent the last several weeks digging through stats for an in-depth look at just how big the problem is and what the community is doing to fight it. Already this year, the Brown County Drug Task Force has seized more than half the heroin investigators confiscated in all of last year. And while the number of arrests is skyrocketing, Target 2 discovered there are hundreds of other crimes like shoplifting, theft, and even prostitution that people are committing just to pay for their heroin drug habit. And the people using are not at all who you think.
It used to be someone in their middle 30s, 40s, probably a male, living in an alley. Now you can drive by somebody that could be high on heroin. I go for walks and I pick up needles out of the lawn.
The number of overdose deaths is actually going down, but Target 2 discovered it's because of growing efforts by friends, family, and trained responders stepping in faster with a life-saving drug.
We've had some folks that have taken up to 5 shots before they revived. So, but everybody has revived, and that's the key. I thank God that the many overdoses that our agency has dealt with, we've had no fatalities, and we also have well over 1,100 people across the state reported reversing overdoses for their peers.
And coming up tonight at 10, it's called the Death Star. It's a new way people are trying to get high, taking them to the edge of death. We'll explain that and how a deadly new combination of heroin and another drug are causing concern for police and emergency responders.
The U.S. Attorney General calls heroin use in this country a public health crisis and an epidemic.
It's exactly what Brown County investigators say they're seeing right here. We have the hard numbers showing the depth of the problem. For the first time, Action 2 News is getting an in-depth look at the great lengths people are taking to get a high. Sarah Thompson joins us now with a Target 2 investigation into the heroin epidemic.
Brown County formed the Heroin Response Initiative last year to attack the epidemic from all sides: law enforcement, education, prevention, and harm reduction. But before they can get rid of the problem, they have to know what they're dealing with. Target 2 discovered heroin is turning businessmen and women to a life of crime, even prostitution, just to pay for their habit. Some users are even taunting death, trying something called the Death Star just to get high, and it's all happening right next door.
My fear is that the problem has gotten so big that we'll never eliminate it. I don't think that's going to happen, to be honest.
Drug Task Force Lieutenant Dave Poteet is at the front line of the war on drugs. He sees heroin consuming lives, driving once hardworking and upstanding community members to the extremes.
The heroin user wants to get that supreme high.
They were going as far as they could to the edge of death, and they were coming back and surviving.
It's called the Death Star.
So what they do is they take a dose that they know is going to take them past that point. But they have one of their friends there with Narcan, so once they get to that point, they'll inject them to reverse the effects.
Narcan is the same drug doctors and emergency responders use to revive overdose victims. As the number of overdose deaths has started to decline, Target 2 discovered the number of people being saved in Brown County is skyrocketing. From March of 2012 to now, St. Vincent and St. Mary's hospitals in Green Bay report 525 people coming into their ERs for drug abuse, withdrawal, or overdose. They've used Narcan 54 times. 131 people have been given that drug by Green Bay Metro Fire EMS crews in the last 2 years. The AIDS Resource Center trains drug addicts how to use Narcan in an emergency. Statewide, the center reports 1,100 saves last year.
Personally, 10, 3 of them in the Green Bay office location and the other 7 different office locations.
Target 2 has learned addicts are no longer using just heroin. Across the country and in Wisconsin, investigators say addicts are creating a lethal cocktail, mixing heroin with a powerful painkiller, fentanyl.
It lengthens out their high, but it also lengthens out their symptoms. So they can easily think they're okay, and then all of a sudden they stop breathing.
all this because addicts are chasing the high they felt the very first time they used, but will never reach again. It drives normally upstanding members of society to a life of crime.
They talk about people getting arrested in the morning, and then when they get out, they need the drugs so bad they're doing burglaries and getting arrested later in the day.
The Brown County District Attorney tells Target 2 it's seen a 400% increase in heroin-related referrals from 2010 to 2013. So far this year, the Drug Task Force has arrested 21 people for heroin delivery or possession, but the DA estimates hundreds more are turning to theft, shoplifting, even sex to fund their habit.
That is the other thing, prostitution. A lot of prostitutes out there who are using heroin or opiates, who are addicted. A lot of times they're controlled through that. Their pimp is also their dealer.
The Drug Task Force says the average age of a first-time heroin user in Wisconsin is around 18 to 20. That's younger than the national average. And the people trying it you'd never expect. Tomorrow night at 10, we introduce you to the new kind of heroin user. Soccer moms living in wealthy neighborhoods, running businesses, and addicted to heroin. One mother's powerful message about this drug tomorrow night.
Drug investigators in northeast Wisconsin have identified heroin as one of the biggest problems in the community, destroying the most unsuspecting families. It's because this drug attracts unlikely users, people many folks call soccer moms. Sarah Thompson joins us now with this Target 2 investigation into the life of a soccer mom addict. Sarah.
Bill, in our research on the heroin epidemic, we found a common phrase drug treatment centers use. No one grows up wanting to be a heroin addict. That's exactly what one Bellevue mother says, yet tonight she's sitting in the Brown County Jail on charges of shoplifting and theft because that's how she says she paid for her heroin. Alice, who asked us not to use her real name and identity, is a mother of two who grew up in Brown County and says she had everything going for her. Family, friends, a college degree, money. Then she injured her knee and a doctor put her on painkillers. For someone with an addictive personality, Alice says that was the beginning of the end. Investigators say an estimated 85% of prescription pill abusers like Alice turn to heroin because it's cheaper and more accessible. It led her to a life she never could have imagined.
I can put up a facade as a soccer mom, and that's what I look like, and that's great on the outside, but you know, that took that from me, what I used to be. It's a death sentence. This is death. This is dying slowly every day, killing yourself slowly. The most horrible thing about it is you can't see how sick you already are. What I did to my family, what I did to my daughters.
Alice's story is like so many other addicts. Tonight at 10, what she says happened when her children found her using drugs, and her powerful message she hopes will keep others from ever trying heroin.
As police try to tackle a heroin epidemic here in northeast Wisconsin, the community is quickly discovering this drug addiction is unlike any other. It's drawing in the most unlikely users, people referred to as soccer moms. Sarah Thompson has been investigating how this drug is affecting families, and she joins us now with what she found out. Sarah.
You think of drug addicts as deadbeat, unemployed, often men who will go into dark alleys to make a drug deal. What you should be picturing when you think of heroin addicts are young people, men and women holding down good jobs, raising families, living in wealthy neighborhoods. We talked to one of these so-called soccer moms who went from having it all to sitting in jail for crimes she says she committed to pay for heroin.
I never touched an opiate in my whole life until I was 28 years old. About the time I was 28, I tore my ACL in my right knee. The doctor prescribed me 40 Percocet a week.
3 surgeries and 1 car accident later, the woman we are calling Alice, who asked us to protect her real identity, was hooked.
I went from the doctor, getting my pills from the doctor, to getting my pills on the street.
Soon, though, pills were expensive and hard to buy. So Alice, who admits she has an addictive personality, followed the path nearly every prescription pill addict does. She found a cheaper, more accessible option: heroin.
I seen everybody else and how they responded, and I tried it. And I'd do anything to never have done that.
After stealing from her family for years, Alice says she started shoplifting to pay for her $50 a day habit. It's what landed her in the Brown County Jail, revealing a dirty secret you'd never expect from this Brown County mother who says she had it all: 2 daughters, a boyfriend, a nice car, and lots of friends.
I was homecoming queen. I went to college for English literature. I had a great life.
None of it fits the stereotype of a drug addict.
I live in a $300,000 house in Bellevue. I bet you don't expect to see me shooting up in my bathroom. And that's what I did.
Heroin caused Alice's life to spiral out of control fast.
I didn't know that there was a time that I had passed out with a needle in my arm, and that was how my kids found me. I didn't know that until my daughter showed me pictures she had taken. These are the things that'll get you. This is where you will end up. This is where your life will take you. If you do heroin, this is how it ends. If it doesn't end here, it ends in a prison. If it doesn't end in a prison, it ends in the ground.
For one of Alice's friends, it almost did. He overdosed, but too scared to call for help, she performed CPR and somehow revived him on her own.
It's not a drug to play with. It's not a drug to do for fun. It kills people. It kills people every day. Me, right now, sitting here, I'm not who I used to be.
Drug investigators can only guess how many moms like Alice are in Northeast Wisconsin, but she says they're everywhere, and so is heroin. Alice says people who used to deal crack or marijuana are now turning to heroin because they see money in it.
They see dollar signs. They see, oh, there's a big heroin epidemic. So they go to Milwaukee, they go to Chicago, and they bring it to Green Bay. I myself have given rides to dealers to bring them because that would get me hooked up.
All this from a woman who says she could be your next door neighbor. She knows heroin sucks in the least suspecting people.
It'll kill your family. It'll take everything from you. And it won't give you anything in return. It's a death sentence. It's slow suicide. And for a kid to try that, how sad. How horrible.
Alice says now that she's detoxed in jail, she realizes she wants help, and she's not the only one. Tomorrow night at 10, we'll show you how Brown County is working to connect addicts with treatment, the cost for it, and how scholarships are even being created to help pay for it all.
As heroin use explodes in our community, law enforcement say there's only one way to tackle it, not jail, but treatment. Target 2 investigates. Sarah Thompson found out about treatment options available and what they cost. Sarah.
Bill, Target 2 discovered there are a lot of treatment options available in Brown County. There are the traditional methods, in and outpatient counseling, being used by hundreds of people right now. There's also a methadone clinic in Ashwaubenon called QAM, Quality Addiction Management, where we've learned hundreds of people are currently going every week to receive a drug that weans people off heroin slowly. Target 2 discovered the cost for treatment ranges anywhere from $20 to $200 a day for outpatient counseling to more than $1,500 a day for inpatient counseling. They say those costs far outweigh what heroin is doing to families and the community when it comes to police and court resources, even jobs. Law enforcement and corrections say they are now realizing treatment is the only way to help heroin addicts.
But we believe that we have sort of a different demographic because I think we're seeing that the heroin people may have had no experience in the criminal justice system at all. And so what we're trying to do then is to have this mix between, you know, punishing and supervising, but then really the major thrust is going to be to insist that they get treatment.
I think people are changing their idea about this illness and that people do and can get well if given the right treatment.
And coming up tonight at 10, Target 2 discovered insurance will pay for some help, but treatment centers say it is creating some major headaches for them. We'll show you their creative solutions, plus new efforts by Brown County to help addicts in the most unlikely of places.
A Brown County judge calls the explosion of heroin use here in northeast Wisconsin a tragedy. Police say arrest won't solve it. Treatment and rehabilitation will. But our Target 2 investigation discovered many addicts who want to get better are priced out. Sarah Thompson has been investigating the new treatment being offered and the barriers to pay for it.
There are more than a dozen treatment options available in Northeast Wisconsin, from in- and outpatient programs to dosing of methadone. That's a drug used to wean people off heroin. All this, though, comes at a price even counselors say is scary.
You just wish that we could have it all back, and it's gone. Heroin will take everything from you, and it won't give you anything in return.
You met Alice, who asked us to protect her real identity last night. She's the new kind of heroin user investigators are seeing: young women, mothers who abuse prescription pills, then heroin. After she says she shoplifted to pay for heroin, Alice ended up in the Brown County Jail and immediately went through withdrawal.
I wanted to die.
Now heroin-free, she realizes she needs help.
I am in desperate need of treatment.
That help is coming in an unlikely place. Target 2 discovered the Brown County Jail is testing a program asking every new inmate if they use heroin and want treatment. None of the information can be used against them in court.
We have that captive audience where people start to look for other things. Maybe if somebody plants that seed with just a simple question saying, do you need help or are you interested in treatment, that people might start to come forward. And I think we're seeing a little bit of it.
5 people, including Alice, have asked for help in the program's first few weeks. Once released,
intervention and referral counselor today.
I got it.
addicts will receive a call from counselors at Libertas explaining options. But then they ask, how much will it cost?
The cost of treatment itself seems scary.
Target 2 asked 3 large treatment centers in Brown County what heroin treatment costs. At Libertas, outpatient can range from $50 to $200 a day and about $1,600 a day for inpatient. At the Jackie Nitschke Center, it's $6,800 for 6 months of in- and outpatient counseling. QAM, a methadone clinic that uses a replacement drug to slowly wean people off heroin, costs $23 a day, but treatment can take anywhere from 2 years to, in some cases, 10.
Several people I just talked to recently, they're saying it's quite a deal compared to what they were spending on the heroin and all the other drugs that they were doing, several $100s a day. This one guy was spending $1,000 a week.
Target 2 found out insurance does cover most drug treatment, but it's limited.
The insurance companies use a medical model. When they're no longer at the threat of death, they no longer have these medical symptoms, then they're cured.
Counselors say addicts are not better in just a few weeks, so they fight for continued treatment.
Sometimes we believe that there is as much as to a third or a half a day on the phone with insurance companies, and some of that time is spent, quite frankly, on hold.
The Wisconsin Office of the Commissioner of Insurance says while that's disappointing, most insurers do have benchmarks for treatment and deny coverage if a person plateaus.
If they're denied the coverage, then I think the information is the key in asking for an additional level of review, and supporting that decision, with evidence is usually will give them the best case scenario.
But appeals can take days, forcing treatment centers to find additional funding to cover that gap.
We have a scholarship payment assistance program to help people get the care that they need if they don't have any family resources.
All this is not just for a few addicts. Target 2 discovered more than 1,000 people received treatment in Brown County just last year for substance abuse.
We've grown, we've expanded, we've had a build out in this clinic in the last year.
The treatment centers tell Target 2 they have a far better success rate than incarceration. That's prompted Brown County Judge Donald Zeidmulder to create a treatment court just for heroin users to start this July.
The old saw, you can lead a horse to water, but you can't make him drink. That's not true. If you have a choice between treatment and prison or jail, it's amazing what a big motivator that is.
Police have put together this guide about overdose prevention and treatment options. It's free and available at the Green Bay Police Department and other treatment centers. We also have a lot of resources and links on our website at WBAY.com.
Brown County drug investigators estimate there are thousands of heroin users in northeast Wisconsin. We've reported on what the drug is doing to the addicts, but it's also affecting thousands of other seemingly innocent victims. Many families of heroin users have no no idea the drug is even in their homes until it's too late. It's in a Target 2 investigation. We talked with a Brown County mother who says it took just 6 months from the time her son first tried heroin to him needing the drug every 2 or 3 hours. The mom, who we are calling Valerie to protect her identity, says she's like many families and never thought heroin could be in her home.
My way of coping, as I realized it was unfolding, or that something horrible was unfolding, is like that I planned for his funeral. I thought, I need to be ready for whatever is the worst that could happen, and that would have been the worst thing to happen.
Tonight at 10 in Sarah Thompson's Target 2 investigation, the drastic move Valerie made to save her son's life and her message to other parents.
Prisoners in their own homes. That's how families of heroin addicts describe what the drug is doing to them. Target 2 Investigates spoke with law enforcement who say heroin use has reached a crisis level. They have no way of knowing exact numbers, but estimate there are thousands of users in northeast Wisconsin. Target 2 discovered the AIDS Resource Center, which provides clean needles to prevent spread of disease, exchanged 2.5 million needles statewide last year, more than double the amount in 2010. They were almost exclusively for heroin users. While those are all high numbers, there are even more seemingly innocent people affected by this highly addictive drug. Sarah Thompson joins us with what she found in this Target 2 investigation.
We've focused a lot on what heroin does to addicts and how it sucks in people with good jobs, families, and friends. But Target 2 discovered who's paying the true cost for these addictions.
I will always cross the Highway 172 bridge and my phone will ring at 5:10 on a Friday afternoon in my mind when I got that first phone call.
Valerie has never touched heroin, but it nearly destroyed her life.
When I got home, I found $10,000 worth of jewelry gone and knew it was him and called the police.
So you had to call the cops on your son?
I did.
This Brown County mother, who asked us not to use her real name for safety reasons, has a son who's a heroin addict. He got hooked on opiates in high school, dropped out of college, and tried heroin for the first time one January. By June, he was a habitual user.
Every 2 to 3 hours of needing another hit of heroin.
Like most parents, Valerie never dreamed her son could be hooked on heroin.
We're a very common family. We're just middle America until it strikes so close to home. Heroin's on television.
But Valerie knew this was very real. She saw the credit cards racked up with debt, the lying, the family heirlooms pawned for pennies of their worth. Like many families, she saw everything spiraling out of control.
My way of coping, as I realized it was unfolding, or that something horrible was unfolding, is like that I planned for his funeral.
After 6 months, Valerie made the most difficult decision a parent could and turned her son in to police.
I knew it was between life and death at that point.
She found a wilderness rehab center in the mountains of Utah, took out a second mortgage for $35,000, and the minute her son was released from jail, sent him away.
I financially could not afford it in any way. But the price I would have had to put on it to bury him instead was something I couldn't face.
Valerie knows she's not the only parent facing these impossible choices. She sits on Brown County's new Heroin Response Initiative, working with law enforcement, counselors, and community leaders to combat heroin use and show others this drug doesn't just ruin addicts' lives.
It's a vicious seductress that takes the addict and the family and anybody who loves that person right along with them.
Valerie's son is one of the success stories. His treatment worked. He's now a counselor himself. But the guilt, embarrassment, and fear for the entire family will never go away.
He spent about 7 months where he wouldn't leave the house and he wouldn't go to the mailbox, wouldn't shovel a driveway during daylight because he was afraid of being seen.
Still, Valerie wants other families to see you can come out on the other side.
It's just important for me to be able to say to the community, please don't give up.
We have links to resources for families and treatment options, as well as our other Target 2 investigations into the heroin epidemic. It's all at WBAY.com.